Morning, all of you. Today we are going to deal about the muscles of facial expression. These are the subcutaneous muscles and they are attached to the skin. We are considering they are the panniculus, remnants of panniculus carnosus. They are developed from the second pharyngeal arch. All the muscles are supplied by the facial nerve. So we are categorizing the muscles of the facial expression into the muscles which is surrounding the mouth and orbit and also the muscles of nose. So first we will see about the muscles of the mouth. Okay. Here you can see the muscles of mouth. The first one, the levator labii superioris alecunesi. Okay, as the name implies, it is going to elevate the upper lip and also it is having action on the nose. Okay, the second one is levator labii superioris. Okay, the long one is the levator labii superioris alecunesi, and the little more shorter one, this is the levator labii superioris. Okay, and also you can see here two zygomatic muscle here. One is zygomaticus minor and the zygomaticus major here. Okay, and another one, levator oculi oris. See, it is going to elevate the upper lip again and it is inserted into the angle of mouth. Okay, the buccinator we will deal in detail later. Okay, orbicularis oris, again an important muscle. We will come to the details of the orbicularis oris later. Depressor labii inferioris and the mentalis. Okay. Next one is the muscle surrounding the orbit. Okay. It is corrugator supercilii, orbicularis oculi. We will come to the details of orbicularis oculi later, and the levator palpebral superioris. This is the muscle of the orbit. Okay, the details of the levator palpebral superioris will come later. Okay. Next, the muscles of the nose. First one is procerus, levator labii superioris alecunesi, the nasalis here, depressor septi nasi, compressor nares, and the dilator nares. So we will come to the details of the buccinator muscle. You can see here in this picture, where is the buccinator located? It is located here, okay, at the region of cheek, okay, and it has got three parts of origin: the upper fibers, middle fibers, and the lower fibers. The upper fibers from the alveolar process of maxilla, the middle fibers from the pterygomandibular raphe, and the lower fibers from the alveolar process of the mandible. Okay, and the insertion into the upper fibers to the upper lip, middle fibers decussate with those of opposite side, lower fibers to the lower lip. Now supply is nothing but it is a branch from the facial nerve. It is called as buccal branch. Okay, buccal branch of the facial nerve. So what is its action? It compresses the cheek against the teeth. It prevents the accumulation of food in the vestibule of mouth. It helps in sucking. Its action is required to blow. Hence, it is called as trumpet muscle. This last point is very important for MCQ. Okay. So the buccinator muscle is usually covered by buccopharyngeal fascia, buccal pad of fat, and it is pierced by the parotid duct. Next is orbicularis oculi. Okay, orbicularis oculi, the picture you can see here, it has got three parts: orbital part, lacrimal part, and the palpebral part. Okay, it encircles the orbital margin. First, about the orbital part. So the origin from the medial palpebral ligament, you can see here the orbital part, this is, okay, the encircled one. So originating from this white line, this is representing the medial palpebral ligament, and it encircles like this and gets inserted into the same point of the origin. Action, it locks the eyelid, thus act as a strong sphincter of the orbit. Next is the palpebral part. You can see the palpebral part here, this above, just above the or inside the eyelid, the skin of the here. Okay. The palpebral part originating from the medial palpebral ligament here and gets insertion into the lateral palpebral ligament. It shuts the eyelid loosely during sleep and it helps for blinking of eye. Next is about the lacrimal part. Lacrimal part, it is originating from the lacrimal fascia, lacrimal crest, lacrimal bone, and inserted into the tarsal plates. Okay, this is the lacrimal part. Action, pulls eyelid medially, dilates the lacrimal sac. Next is the Orbicularis oris. You can see this is the location of Orbicularis oris. This is the sphincter of mouth. This muscle encircles the oral fissure. It is partially formed by lip muscle. It is made up of many layers. So we can divide the layers into superficial, intermediate, and the deep layer. The superficial layer, this layer is formed by the peripheral muscles inserted into the lips. Intermediate layer, it contributed by the buccinator muscle. The deep layer, the muscle fibers originate from the incisive fossa of maxilla and the mandible. Insertion into the oral fissure. Actions. It acts as the sphincter of the mouth and closes the mouth. Okay. Here you can see some muscles and action with its action. The frontalis, can you make out by the action of frontalis? It will raise as the skin of the forehead. Orbicularis oris here. Depressor anculae oris. Corrugator supercilii. Dilator naris. Zygomaticus major and minor acting together here. Mentalis. If the zygomaticus major acts alone, it is the laughing muscle. And finally, the rhizorius. This is the action, rhizorius. So while dealing about the applied anatomy, we will have a detailed study of the clinical anatomy along with the facial now. Okay, so time being, you just understand Bell's palsy. What is the features of the Bell's palsy? Lesion at facial nerve at stylomastoid foramen. It is characterized by deviation of face to the normal side due to dominant and affected muscles, deviation of mouth while talking and smiling, inability to close the affected eye, food accumulates in between the cheek and gum, cannot whistle, cannot wink, cannot wrinkle his forehead on the affected side. Okay, so this is the clinical anatomy regarding the muscles of facial expression. Okay, thank you all of you.